Good evening, this is Dr. Thomas Klein. I'm coming to you from Raleigh, North Carolina, as I have in the past. And we're continuing our series from the National Pain Council and from the JATH Educational Consortium group of researchers. Our goal is to come up with the truth, and it's taken a long time. People who are making generalized statements are not spending the time to come up with the truth. We are. So today we're going to talk about hyperalgesia. Hyper meaning high, algesia meaning pain. It is a topic that's going around at the FDA in their anesthesia and analgesia drug approval committee, whatever. Here's the issue. Hyperalgesia means that your pain is getting worse with treatment. They've done a bunch of studies in animals and stuff and shown that in some animals, when they're on opiates, their pain threshold is different. In other words, you hit them with a little pinprick and it hurts more. That's a far away idea from what is really the agenda, which of course sounds to be anti-opioid. This is a person, let's say they're on 500 milligrams a day of oxycodone for their terrible painful disease like CRPS or adhesive arachnoiditis, which have been identified by the National Institute of Drug Abuse as 10 million people who require opiates every day. And this is our group of rare painful diseases, which National Pain Council is drawing together in a little compendium. But if a person is taking, say, 500 milligrams a day and they start to have more pain, what the excuse is, oh, this is hyperalgesia. This is a side effect of the opioids. Therefore, shouldn't have been taking the opioids in the beginning, in the first place. So this is being used as another axe to try to cut opioids that we've been using for 5,000 years out of the pharmacy. Problem is, there's no other drugs. FDA has only approved one drug for severe pain. So let's go back to the hyperalgesia. If a person is getting worse, chances are the disease is getting worse, or they're developing tolerance. Now, tolerance is when your body gets rid of things. So if you take drug X, your body doesn't know it's a good deal, doesn't know you really want to take it, so your body gets rid of it. And this is what happens to a large percentage of people. It's even mentioned by the FDA to be expected, tolerance. So now we have the person on 500 a day and their pain is worse. So it either could be a worse disease or tolerance. But the people are jumping in and saying, oh no, hyperalgesia. We have reviewed a lot of papers. And our opinion right now is that it is not clinically important. The real approach would be, if this person is getting worse and you claim it's from the medicine, then if you reduce the medicine, the pain should go away. It's a simple thing. So if a person comes complaining of more pain on the same dose of medication, give it a quick try. Have the patient cut back and see whether or not their pain's better. And if it is, then they have hyperalgesia. But politically, see, this is being used as a way to tarnish our opioid pain medicines. This is a little study that was done by Jennifer Schneider, MD, PhD, and she concluded that most of the rhetoric around these topics has occurred with very little in the realm of real-world data. So in other words, they're quoting animal studies. We've came across no clinical studies whatsoever. It appears that tolerance and hyperalgesia are not foregone conclusions when considering a patient on long-term therapy. So she's saying, hey, don't use this as an excuse. And we've seen this happen. People, especially surgeons, patients want to be treated for their postoperative pain, as most humans do when they're being operated on. And the surgeon will say, oh no, you're liable to get hyperalgesia, like it's some kind of rash or something terrible, but it's not. So don't be buffaloed. If somebody says we're not going to treat you because of your hyperalgesia, you say, well, the National Pain Council really has a totally different idea on that. Do you want to contact them, or would you like us to contact them for you? By the way, the way to contact us is through our Gmail, which is nationalpaincouncil@gmail. And if you want to talk to us, that was the email. If you want to talk to us, we can just look up National Pain Council on the website, and nationalpaincouncil.org/publications. You can get our latest publications. Also, while you're there, you can sign up as a member, and also while you're there, help us out and donate a little bit of money. Thank you, and good night.